By now, you've probably heard that the diabetes medication Ozempic is helping people lose a lot of weight.
But one side effect that hasn't been discussed as much is when the drug could cause weight gain. So we've got Dr. Vadim Sherman, and he's the medical director of bariatric and metabolic surgery over at Houston Methodist Hospital, joining us live. Good morning.
Good morning.
All right, so Dr. Sherman, a new study talks about what happens when a person stops taking Ozempic. Is this similar to what we saw with another drug where people on average gain 2/3 of the weight they lost back within a year?
Absolutely. I mean, that's very concerning. The medication is very effective. It acts as a tool. And so as soon as you stop taking the medication, you no longer have that impact on your hunger, on your appetite, and that's when the weight starts to come back.
And it can be very expensive, up to $1,400 a month in some cases. So what is your take on this? Do you feel like this medication that was supposed to really be for diabetes is a good medication for weight loss?
Oh, it's fantastic. There's no doubt about that. The caveats are you have to be on it for life if you want to have these permanent results. So you need to make some permanent changes, not only in the amount of food that you eat, but especially in the type of food that you eat. And so when you make those lifestyle changes, then you can have lifelong results. The medication acts as a tool to help you make those changes.
All right, so if someone is on it, are you saying that they need to be on it for life if they're on it right now? Like, what is the actual realistic recommendation if they don't want to gain that weight back?
Well, that's a good question. I mean, obesity is typically a chronic disease. And so, like high blood pressure, for instance, you may need to be on medications for as long as possible to control that blood pressure. When it comes to obesity, we can also impact it without medications. We can impact it without surgery. What we do with surgery and medications is that we use those as tools to make a bigger lifestyle change. So if somebody can change the type of food that they eat and the amount and the activity level and all those facets of life, then you may not need the tool there and you are controlling everything on your own.
So can you explain what's happening with this medicine so people understand it? Is it cutting off that urge to eat? Does it just sort of wipe out your appetite, or what happens? Why are people losing weight in the first place?
Very much so. There's really no magic to it, but it impacts your hunger between meals. You feel full after smaller meals. And basically, the hormones that are being affected here are very similar to what happens in gastric bypass surgery. And so the difference between surgery and medication is that when we do the surgery, those changes in the hormones, they happen and they stay changed for a long period of time. With this medication, you have to continuously take it on a weekly basis with injections to continue to have that effect.
Yeah, so it sounds like the second you get off of it, you just get those major urges to just eat a ton again, I guess.
It makes it more difficult, absolutely. And so this is where it's very useful as a tool to be able to help with controlling hunger, appetite, fullness, all those things that are important to weight loss and especially weight gain.
Well, docs, some people aren't even able to find Ozempic at this point. There's a shortage going on in lots of pharmacies. So what's your best advice for someone who needs to lose a lot of weight now?
Well, that's a great question, because not only is there a shortage of these, typically a lot of insurance companies don't cover this medication. It can be very expensive per month. And what ends up happening is patients start to look elsewhere, online pharmacies. They go to other countries. So there are other ways to do it. But ideally, the goal is use the medication as a tool, make a permanent change, get permanent results.
All right. Excellent information. Thank you for taking time to walk us through this today from Houston Methodist, and just hope that people realize they need to understand this before they start taking it. Thank you again.
Absolutely. My pleasure. Thank you.